Today on 21st Century Business, explore state-of-the-art technology, innovative business strategies, insights from cutting-edge corporations around the globe, a visionary look into the answers of tomorrow, today. Business leaders, business solutions, 21st Century Business.
Welcome to 21st Century Business. I'm Jackie Bales. In the healthcare system, claims and medical management professionals spend countless hours on routine tasks, leaving less time to actually resolve claims and get injured employees back to work. That's especially true in workers' comp, with all of its complexities and the disparate entities involved. Finally, a new web platform designed to make all of this easier has emerged. We're joined now by James Schluter, President of Effective Health Systems. Welcome, James.
Thank you, Jack. I'm glad to be here.
And Greg Bernhard, Chief Operating Officer of Effective Health Systems, joins us as well. Welcome to you too, Greg.
Great to be here.
James, first of all, explain the difficulties faced by the insurance and medical management industry, especially when it comes to workers' comp.
Well, the problem is technologies have just not kept up with the demands of the workflows. We have a lot of players involved in this, and they all have different technologies, and unfortunately they don't talk to each other. So that means that the people charged with managing claims are doing a lot of tasks, and the technologies are efficient, but they're not helping the effectiveness. So that's got in the way of a lot of things.
So Greg, tell me about Effective Health Systems and specifically about your technology solution called Baseline.
Right. It really is a platform as a service along with other software as a service pieces within it. And what we do mainly, there's three main tasks. We are automating workflows, we're managing all the stakeholders, and we're also auditing for expectations. So for example, in the utilization review pre-authorization world, we're using nationally recognized medical evidence-based guidelines to help streamline those UR requests that can really just fly through the system. As for the management of stakeholder piece, we're able to automatically make referrals to the groups if something doesn't certify. So, actually 60 to 80% of all the things do certify through the technology, but if they don't, in today's world, what has to happen is they have to make a phone call or send a fax to go out to a peer review. Our system's able to connect that and just make those things happen automatically. And finally, the audit piece, every piece of data that comes into our system from all the different technologies, you can report on those, you can run audit reports, and what's really great is that the whole end piece of the process is bill review, and every piece of the UR process in that example that I gave you feeds right back into bill review, all seamlessly.
Well, it sounds like a really powerful system, so I want to ask, overall, who benefits from your services?
Well, ultimately, the patient benefits, because the patient who's been injured gets the care they need much more quickly and are able to get back to work.
Right.
So the economy gets improved, costs are lower, we all benefit. It's a good system.
Wow. It sure sounds like it would work. So let's take a more in-depth look at the problem and how Baseline contributes to solving these issues in this 21st Century Business Field Report.
Accidental injury in the workplace occurs in the millions yearly. Therefore, it is both essential and required by law for employers to maintain insurance to provide workers with both wage replacement and medical coverage for such injuries. Effective Health Systems provides the solution.
Our decision to integrate Baseline into our Caseworks environment was based on our clients' needs. As we looked in the marketplace for a viable UR solution to incorporate into our technology platform, Baseline was the most innovative and efficient solution for us.
Using a process called utilization review, or UR, reduces the total claim cost to the payer by ensuring the care being provided to the injured worker is medically efficacious. Effective Health Systems' new technology, Baseline, has the capacity to target and automatically approve those requests that will be approved by the UR process using evidence-based and empirically tested guidelines that are nationally recognized and accepted within the industry.
Baseline is not only efficient, but an effective tool. Our clients have seen over 50% reduction in the routine manual tasks that their nurses usually had to do in their old process. That's given them the opportunity to address the more complex determinations and, in addition, eliminate a tremendous amount of their administrative functions so they can address the clinical aspects of their files.
Effective Health Systems' Baseline UR Assistant operates as a standalone web-based program within the company's Baseline interoperability platform. The UR Assistant can also be integrated as a background web service solution within a client's existing claims or medical management technologies, improving workflow and adding value to services already provided by the insurance and healthcare communities.
Baseline was not complicated at all to integrate into our Caseworks environment. Actually, it was very seamless and took less than 3 weeks for a full integration. For example, our integrated product was just adopted by one of the largest TPAs in the industry, Gallagher Bassett, for their Med Insights Nurse Case Management Group. And the total integration time frame from beginning to end for that implementation was less than 2 months.
Entering a request in Baseline is quick and simple. The required data elements are entered using Smart Search technology, which leverages the many databases within the system. An ICD-9 code is selected, as well as the body part related to the request. Finally, the type of request is selected. Again, using Smart Search technology, the specific requested procedure is selected and the number of units will also be entered by the user. In this example, an MRI of the knee is being requested and will be adjudicated against the guidelines in Baseline. The user runs the protocols and the guidelines are applied to the request, taking into account all required data elements as well as the previous history on the claim. In this example, the MRI has been determined to be medically appropriate and Baseline has auto-certified the MRI. The certification letter for the requesting provider is automatically created in Baseline, which includes capturing all of the stakeholders as parties to the letter. This happens instantly within Baseline. In addition to the letter, all the audit requirements related to the UR process have also been captured and can be reported on in real time. As a platform as a service, Baseline is able to make referrals automatically to the client's preferred vendors. In this case, the MRI referral was made in real time to One Call Medical for the MRI service. With Baseline, the need to call or fax a referral is no longer necessary. Letting the technology perform these tasks allows the UR staff to focus on more important activities. The auto referral piece to ancillary vendors is an extremely powerful function of Baseline.
Well, Jim, it appears that the potential impact on healthcare and insurance costs must be pretty significant then.
It is. Our clients have found they're able to reduce their operating costs by about 60%. 60%. Not only that, the impact on the patient is instead of waiting 3 to 5 days to get the decision back to the doctor so that they can get a treatment, it can be done in a matter of seconds. So that's phenomenal.
Now, Greg, Baseline helps in making these medical decisions, though. Shouldn't doctors and nurses be doing that? How does that work?
Yeah, doctors and nurses still do make ultimately the decisions, but there are some things in the largest states, California, Florida, Texas, where national guidelines are in play to make certain decisions based on diagnosis. Baseline takes those, we target those requests specifically based on diagnosis and request, and we're able to target those and clean those out. And it's 60 to 80% of the requests that come through that hit those guidelines are able to get certified at that level. So ultimately, again, the decisions are being made by medical professionals, but they're relying on guidelines. We just have those guidelines now embedded in the platform.
And if I could,
Sure.
That's where the software as a service comes into play. We have the platform as a service, which brings the integration, but we have various softwares that are able to be implemented into existing technologies to make them more efficient. So our pre-authorization package, for example, very important element, cuts days out of the time frame, but the companies don't have to invest a whole lot of IT time to make it happen because we can just put that piece into their existing technologies and it happens without anybody seeing it.
So, Greg, you're talking about very significant cost savings, but what about productivity? How does your system affect that?
It's interesting. We went into one of the large insurance companies where their nurses do nothing but utilization review, and basically their standard of productivity was to do between 8 and 10, maybe up to 12 UR reviews per day prior to us coming in. We have nurses there that are doing 25, 28, 30 per day now, and it's funny, originally they were maybe a little threatened by the concept of having technology help them because they're the medical experts, and they really are, but now they would say they wouldn't want to do utilization review without this sort of technology.
Amazing.
We're eliminating the tasks and the mundane routine things so that the professionals that have gone through school, been educated to make these tough decisions, are spending their time doing what they were educated to do instead of routine stuff that technology handles better.
You know, you mentioned the cost. What is the investment required to implement Baseline?
Well, since Baseline is a platform and a software as a service, there's really no upfront cost. We're able to take the existing technologies that clients are using, their claim system, their medical management system, their ancillary vendors, the bill review, and bring that all up into one place, and it starts working. So our costs are really transactional in nature. The clients only pay for what they use.
It seems to me that something that is putting all these entities together and allowing all of these decisions to flow, it seems like that should have been happening years ago, but it wasn't, was it? Why not?
Oh, as I said, even 5 years ago, this technology didn't exist. So we're really bringing something into play that maximizes the IT investment that has been made, maximizes the professional time that they're currently doing, eliminating the routine, redundant kind of tasks. And it can work today.
You know, that whole web-based cloud computing, you know, as Jim indicated, that just wasn't there before. And now we have the ability to do that. So it's just something that was really needed in this industry.
Wow.
And then I think the other piece that works here is that both Greg and I have been in this industry quite a while. And we've both been around pretty much all the aspects. And when we were delivering our initial technology, which just was the pre-authorization piece, you know, we saw, you know, we were able to squeeze that part of the balloon, and then another problem popped out here. And Greg and I took the upper level look and said, well, let's squeeze this balloon on down. And that's where the platform began to get started, because we saw that, you know, the insurance companies and the other companies involved in the process couldn't scrap their technologies.
Right.
You know, so we had to find a way to make that all come together. And that's where the platform came into being.
That is amazing. So, Greg, approximately how many transactions are you doing, say, in any given month, and how many employees are using Baseline?
Yeah, we're doing tens of thousands of transactions through the system every month right now, and we have hundreds of users using it, and we're talking about users at insurance companies, third-party administrators, the largest managed care companies out there in the country, and there's other opportunities that we're looking at getting in, but it's a pretty robust system, and what's great is that it's very scalable. Being web-based and in the cloud, you know, if a client doubles their business, you know, we just give them more space. So that's one of the nice things about it.
And it's also scalable in that we're not recreating the technologies that exist. So we're not adding a whole lot of servers and that kind of thing, because it's already there. We're just making it become able to communicate.
You're making everything work together.
Right.
Greg, you talked about making referrals to outside vendors. Can you talk a little bit more about that?
Right. I think I talked about, you know, things going to doctors and nurses for reviews that didn't get approved at the front end level. We also, when things do get certified, we're able to make the referrals to ancillary vendors. So for example, if the doctor says you need an MRI and that MRI gets certified, we're able to make that referral directly to the preferred MRI vendor. Or let's say it's a DME, like a wheelchair or a cane. If the client has a preferred vendor, we're able to integrate with their system directly. In today's world, they have to call the DME vendor or the physical therapy group and make that referral. We've already contracted with several of these providers out there, and we're able to make those referrals directly through the platform.
So yet another way that it really simplifies the process.
You know, and again, you said it seems so simple. Why wasn't this done? It wasn't done. And you know, now the way technology has grown, it's just sort of a no-brainer to do that, and it really is getting a lot of traction.
And it's the pieces that bring the connectivity together. For example, in order to make that happen, the system has to be able to recognize that a decision was made. It has to recognize what type of decision was made. Was it a diagnostic or a PT or MRI or an X-ray? Who is the preferred vendor of the client, which could vary. Could vary by state, by region, by whatever. And then it has to know how to connect to their technology. So it sounds like a very simple thing.
No, actually it doesn't.
But it's very complex in the background.
Sounds hard.
And what makes it wonderful is that nobody sees it happen. This is a software that our clients can pull out of the air, plug into their system, and it just works.
Now, what do you see in the future for Baseline, Jim, say a few years from now?
Well, we're really pleased. This technology has been very well accepted within the workers' comp market, and it's spreading. We're seeing the group health market coming to us. We're seeing the auto injury, personal injury issues coming to us. We're also seeing, as we develop this, where that balloon is expanding out over here and over here. We have applications that we're being contracted with by some provider groups to be able to have that same technology be put in place so doctors have the information that they need before they submit the request. We have, so it's growing.
Very, very interesting. You know, we are all quite familiar with the societal stresses that are caused by increasing medical costs. So if this program of yours can help contain those costs and help employees get back to work more quickly, a huge improvement. Thank you so much, James and Greg, for sharing this with us.
Thank you.
And thank you for watching. For 21st Century Business, I'm Jackie Bales.